Well, it's time once again for our In Focus Health Report, and Linord Moudou joins us, and you're going to tell us about where President Bush is and what takes him there.
Hello, Dimiake, and hello, everyone. Well, former U.S. President George W. Bush is visiting Zambia to promote a health initiative that focuses on cervical and breast cancer prevention and treatment. The trip, which will also include time in Botswana, is part of the Pink Ribbon, Red Ribbon initiative spearheaded by his Health Foundation. It seeks to expand cervical and breast cancer screening and treatment in sub-Saharan Africa. The former president is traveling with his wife, Laura Bush. Also traveling with the president is Voice of America's Brian Padden, who joins us via Skype from Zambia. Brian, welcome to the program.
Thank you.
Well, Mr. Bush arrived this past Saturday in Lusaka, Zambia. Can you tell us what has been on his agenda so far?
He came to promote the treatment and prevention of cervical cancer, but he also came to work. A large part of his time here was helping to refurbish a clinic that was going to be used, the first clinic in Zambia specializing in the early detection and treatment of cervical cancer in the city of Kabwe, about 2 hours from Lusaka, where I'm sitting now.
Now, this is the second time that Mr. Bush is visiting Zambia. Why is this country significant?
This country is significant because there has been a lot of movement and momentum to address the issue of cervical cancer here already. Zambia has the second highest incidence of cervical cancer in the world. There are doctors who have been working here, programs in place through the CDC to try to address that. And Mr. Bush, building on one of the great successes of his presidency, when in 2003 he passed a bipartisan $15 billion AIDS treatment and drug program for Africa that saved the lives of between 4 and 5 million Africans. He wanted to build on this to address the issue of cancer, and particularly cervical cancer in women, because many of the women who have cervical cancer here in Zambia are also HIV positive. Their immune systems are low, and they're more susceptible to get this disease.
Now, what type of impact do you think that this program is having, this initiative, whether it's, you talked about the combination of HIV and cervical cancer. Can you tell us about the type of help that these women are receiving there?
It's a very simple process, and it's using very available technology. These clinics that are being set up, they're training health workers, and the supplies they need are one, vinegar. They apply vinegar to the cervix area, the health workers do, and then they'll, using a digital camera, see inside the woman to see if the vinegar left any white marks. Those white marks are called nodes. These nodes are the beginning of cancer in the cervix, and they can use a little CO2 tank and a hose and freeze those little nodes and treat the cancer before it can spread to vital organs in the body.
Now, this approach that you're talking about have been said by many experts to be cost-effective. Now, tell us about prevention steps. We heard about a rollout of the HPV vaccine. Quickly tell us about that in 30 seconds.
Well, that's one of their goals to do this. They don't have a specific time frame in mind, but it is the next phase. Right now, they're trying to work on these treatment and prevention centers throughout the country and make Zambia a model for this program, and then they'll move on to the next phase. Soon, they hope to start delivering the vaccine, the HPV vaccine, to prevent the disease in young girls.
Oh, wonderful, Brian. Thank you so much for that report, and have fun in Zambia and be safe.
Thank you.
Okay, and that's all we have for today. And for more information on any of today's health stories, be sure to visit our website, africahealthnetwork.com. Back to you, Dimiake.
Well, thank you so much, Linord. That's great. And of course, for our viewers, Linord Moudou joins us every Tuesday and Thursdays right here on In Focus with the latest health news.